you're a cash pay physical therapist and you're wondering what can you tweak inside your initial evaluation or follow-up sessions, or what's one mistake that you might be doing that you don't even know it was possible. My name is Garcia. I'm the CEO and founder of Sports Performance Physical Therapy. I've been in cash pay private practice for about 10 years, and I have scaled to 3 locations. And after mentoring thousands of physical therapists, I've seen them make mistakes early on when they become new to cash pay physical therapy, whether they come from a traditional insurance route or they're treating cash pay inside insurance. And this one tip will help you navigate what it is that you can do to clean up just a little bit of your sessions and really give that patient the outcome and the value that they want. That big mistake that people make early on is that they think time is the biggest piece that these cash pay patients want. It's not that they want time, they don't want more time with you. And the only reason that we think that way as a physical therapist is because you've had such a little short time in a traditional insurance-based model. So if you've been in practice for a while, you might have grown from an hour-long treatment sessions in insurance-based care to 45 minutes and maybe even now 15 minutes of care. So you're probably seeing anywhere from 4 to 6 people an hour. And because of that setting, we know cash pay patients, they go away from that model and they want to go to something different. And as a physical therapist, we assume what they want is the time. And that's the problem. The patient doesn't want more time with you. They don't want an hour and a half. They don't want 2 hours with you. Ultimately, they want the solution. So if you think that treating them for an hour or 45 minutes or 60 minutes or 90 minutes, that's not what they want. And so as a new physical therapist in cash pay setting, you create bundles, packages, sessions based on time. Or if you want a 30-minute, you want a 45-minute, you want a 60-minute, you want a 90-minute. They don't want more time. Ultimately, they just want the solution. So if you can get that solution faster, that's a good problem to have because that's all the patient wants. And so if you get tied up into more time equals I'm going to charge them more, I'm going to charge them less. That's not what it is. So anytime that you're working with these people, don't assess, don't create your sessions, don't create everything that you do off of time. It's an hour-long session with a one-on-one with a physical therapist. That's not what they're looking for. Just because you came from an insurance-based model or you think that that's what people want in insurance and that's what they're getting, the problem is that they're not. It's not that they don't get the time, it's that they don't have the time to find the solution inside 15 minutes. So it's not 60 minutes. They would be happy if you did it in 30 minutes. Now, if you can solve their problem in 30 minutes, that's the crux, that's the paradox of cash pays PT, is that you've come from a scenario, an environment of 15-minute care, and now you think that hours long is going to fix them. Well, you get stuck because you're like, well, what do I do for this hour long? I've done my evaluation, I've done follow-up questionnaire, I've done some manual treatment, I've done some exercise. By the 40-minute mark, you're like, what am I doing here? What do I do next? And so you just end up talking to them more. But the reality is where cash pay PTs struggle early on and they think it's time. Really comes down to is what's your skill set to solve their problem? Do you really understand their problem? That is where you need to spend your energy, not creating more and more sessions or packages on 30 minutes, 45 minutes, or 60 minutes. How do you get more effective at trying to solve the problem that brought them there in the first place? And that's not tight hamstring, that's not poor hip mobility. Something has gone wrong inside their weekly, monthly lifestyle of fitness and playing with their kids, whatever it may be. Something's going on in their lifestyle that's being hindered by their pain. Can you solve that problem? And if you can get it done in 30 minutes, that patient will be happy. You spend your time there, all your energy in this concept, you'll be able to have more cash pay PT patients that are happy with you, they're thriving, and you can actually see more people improve more outcomes a whole lot faster instead of thinking, I have to treat people for 90 minutes. That's not the direction to go, and I hope that helps you inside your clinical practice.